Literally everybody on the planet Earth who has heart disease has their disease because in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages in plaque. And I think the thing that I always like to emphasize to because it's true of every single patient on the planet who has ever had heart disease. At one time, they had no heart disease.
This is Doctor Talks.
Well, hello, everybody. Welcome back to the Reversing Heart Disease Summit. I'm Joel Kahn, MD, and I have the honor and the privilege and the pleasure of a hero of heroes to have Dr. Caldwell Esselstyn, medical doctor, on Zoom with me. We all celebrated birthday number 90 in the past year, and he's going to dazzle you with his always good looks, always good looks. Look at here. Look at that picture. This book is 18 years old, and it looks like the same smiling, happy face. And Dr. Esselstyn, thank you so much for being on with me. Thank you.
Well, listen, Joel, this is my privilege. Thank you for having me.
We could go back and forth with accolades, because literally the first time I got to meet you about a dozen years ago, I have the picture. I wrote an article about it, highlights, and then, of course, your interaction with our plant-based nutrition support group in Detroit and our mutual love fest for Paul Chatlin and all. But, you are naturally beloved around the world. Very few people have a diet that carries their name. In fact, I'll tell you, I just got on the panel for the U.S. News and World Report to rate diets, and that'll come out. It's a popular edition of that magazine. And, there's lots of diets, but, other than the Ornish diet, which does carry, of course, Dean's name, all my patients come to me and say, well, I follow the SC diet. And anybody that by any chance doesn't know that Dr. Esselstyn is affectionately often called Essie, I think in the family and by patients, and the diet is described as the Essie diet. So let me ask you, if you were to rewrite this book, I noticed published originally in 2007 and paperback in 2008. I have so many copies here because patients walk out with it. Preventive reverse heart disease, which is the topic of the summit. And would you write anything different? Does anything strike you? Oh, we've learned since then and didn't know what we know now?
Yeah, if I had wished you'd asked me that question this morning at 7 a.m.,
Why is that?
Well, then I could have really dug through it and find out. Yeah, I think I was a little bit unclear at that point about things like arginine and things like statins. And I think that I feel a little bit more strongly about some of those things now.
Well, let's go there. Let's start with arginine, and you're probably talking about dietary nitrates, and share what you would have added to the book. That's an important part of heart disease.
Well, I think that the key thing there, I think, is, well, this is twofold. If you're going to succeed with arrest and reversal of heart disease, number one is the patient has to understand where you're coming from. And number two, the patient has got to want to do it. In other words, I didn't really explain, I think, as well as I should have, what is the causation of the illness? Because, there's been a basic covenant of trust from the days of Hippocrates that whenever possible, the caregiver will share with the patient what is the causation of the illness. And sadly today, in cardiovascular medicine, that is simply not being done. We have people with stents, we have with bypasses, all kinds of imaging things. We change the rhythm. We don't address the causation of the illness. And the reason that I think that we have succeeded in showing that you can halt disease progression, and often you can see striking examples of disease reversal, is because we explain in detail the causation. And I don't think I did that as well in the book as I would have liked to.
Okay, and that overlaps with the idea that damaged endothelium produces
Absolutely.
less nitric oxide that you can augment through diet?
No question. if they understand that all experts seem to agree that where this disease has its inception, its onset, its beginning, is when we progressively injure the life jacket and the guardian of our blood vessels, which happens to be that delicate endothelial lining, which has the responsibility for making this absolutely magic molecule of gas, nitric oxide, which is responsible for the salvation, preservation, and protection of all of our blood vessels.
And we can harm that magical lining that protects us and produces nitric oxide. The recipient of the Nobel Prize in Medicine 1998 for 3 researchers. We can damage that endothelium through the Western American diet. I'm sure we agree, through smoking, through uncontrolled high blood pressure, uncontrolled high blood sugar, maybe bacterial, products, damage gut. Any others? Oh, obviously a diet.
What were they? Dr. Furchgott, and Dr. Murad, and Dr. Lou Ignero.
Look at you, Clay. All 3 Nobel Prize winners there that you just rattled
And
off.
well, they did that, what, in 1988, but it took 10 years to give them the Nobel Prize. And we have to ask ourselves, what is it about nitric oxide that made it worthy of a Nobel Prize? And it's because of the functions of nitric oxide. And I really explain that in some detail to every patient who we see. And when you think about it, when a patient the reason we were running close to 90% compliance in our last paper, when they think about it, if a patient has grasped and got their arms around the relationship with nitric oxide and the endothelial cell, and it is because they're sitting there with angina because they've destroyed enough endothelial cells that they're so deficient in nitric oxide, they haven't protected themselves from making these blockages. But what is so exciting about this, once they grasp that and they tie in to the whole food, plant-based nutrition, it's surprising how, especially, and it's a delight to treat those patients with angina, because often within 2, 4, 6, 8, or 10 days, they used to walk 2 blocks and get angina. Now they have to walk 4 to 6 blocks. And they suddenly recognize, my God, this is working. And you rarely would you ever have anybody come up to me after our seminar and say, Dr. Esselstyn, that was very interesting, but in 2 weeks, Lois and I are going to have our 35th wedding anniversary. And I guess I'll kill off my few remaining endothelial cells. Not going to happen. No, they are so delighted to be empowered as the locus of control in this disease. Because when you think about it, literally everybody on the planet Earth who has heart disease has their disease because in the previous decades, they have so sufficiently trashed, injured, compromised, and turned their endothelial system into an absolute train wreck that they no longer have enough nitric oxide to protect themselves from making blockages in plaque. And I think the thing that I always like to emphasize to every because it's true of every single patient on the planet who has ever had heart disease, at one time, they had no heart disease. They worked hard to create it, and we have to show them how they created it.
Now, my own perspective on what you're talking about is, it's a very rare office visit for a cardiologist or an internist to discuss nitric oxide with a patient. And I think largely is the lack of easy testing. If it was blood sugar, it's a common conversation, but, we have saliva test strips that are of variable accuracy and maybe not, they reflect salivary nitric oxide. They obviously don't reflect endothelial nitric oxide directly. And then there's a blood test that I do on everybody called ADMA, but the science is strong. It's a very difficult blood test to modify the number, even with diet changes. I've been very frustrated trying to find a supplement or a diet that theoretically brings it back in the normal range, because the science studies say it's a rather good way to assess endothelial nitric oxide production. So I think the lack of testing is there. So I think most people watching this interview will know that you advised to that angina patient you just mentioned, 5 or 6 servings of lightly steamed greens, anointed with balsamic vinegar. As I want to be a good student of the SE program. What do you think about, and I'm not trying to be at all contentious, part of the first shot approach was that maybe arginine as a supplement, maybe citrulline as a supplement could augment the dietary nitrate approach. Of course, I think the arginine and citrulline were known before the dietary pathway, but do you have any thoughts that that's a cop-out or effective?
Well, when you think about it, in the metabolism of nitric oxide synthase acts upon arginine to produce nitric oxide. And the natural thinking, therefore, would be if I had more arginine, I'd have more raw product to present to nitric oxide synthase, and I'd have more nitric oxide. However, that isn't the way it works out. It so often happens. A study was done, I think, in 2006, where they took men who had had a recent heart attack,
right,
divided them into two groups. One half was controlled. The other group was getting supplemental arginine. They prematurely stopped the study.
Right.
There were 6 new heart attacks in the arginine group, none in the control group. So it seems to be that when you try to override nature, often things begin to go astray. So I learned what this stuff about the green leaves from really Nathan Bryan from the University of Texas, who I think did a lot of this pioneering work, and give him credit for that. But if it's a nitric oxide deficiency, then what is against somebody safely making their own nitric oxide, which these patients do 6 times a day? Every time they're chewing a green leafy vegetable, and then of course they swallow the saliva with the nitrate, right, and the nitrate gets reduced to nitrite, and then when they are swallowed, your gastric acid further reduces the nitrite to more nitric oxide, which can enter the nitric oxide pool. And I think it's so powerful. If I can get patients to understand that in a simple way, they can feel so excited to think that every time they do that, they are presumably halting and reversing their disease.
I think you and I should present to your son, Rip, who I'm also going to be talking to, I think this weekend, that the Plant Strong line should include Essie gummies. Make it easy for people. Just put a little spinach and balsamic in a sugar-free vehicle, and I bet you people would chew them down. I don't know why. My patients love gummies, and I try and dissuade them. That's just another processed artificial product. So you made a provocative statement, and it's interesting. I wanted to ask you about this, but you would rewrite some of the book about statins, and that's an open-ended statement. So I don't know where you're going with it, and I'm curious as heck to know.
Well, I run this seminar about every 6 weeks. 30 patients will come in virtually from throughout the United States and overseas. And again, this is also one reason we, I think, have more compliance, because we don't give them a 10 or 15-minute office visit. It's 5.5 hours. And in that 5.5 hours, they're going to learn all about the causation of the illness and also about how we're going to try to empower them to halt and reverse the disease. In addition, we have, during that 5.5 hours, Anne has a wonderful presentation about food. I get 3 hours. Then we have a wonderful patient who was a previous patient who had obviously a wonderful result, and he is very eloquent. And believe it or not, my son-in-law has a wonderful little talk called Food Architecture, which really shows people how to handle their food readily and get it prepared. And now, give me the question again.
It was about what aspect of statin therapy would you modify in the book?
So during the seminar, I also make it a point that I have to speak with every one of the patients who's going to attend. My secretary will give me their phone number, and I'll be in touch with them usually 2 weeks beforehand. And I spend about 30 to 40 minutes going over their history and all about nitric oxide. So they get a double dose of that information. But many of them will come and say that they simply could not take a statin. See, I would say 99% of these people do have a cardiologist or a physician on the outside. And the one thing that I make it very important to follow is that I must never say anything that is going to drive a wedge in any way between the patient and their doctor at home. This is looked on simply as a supplement to show them how to eat. But of course, the bonuses are much more beyond that. So they can't, let's say they've tried a statin, they can't take it. And now we have plenty of data clearly showing that those patients, when they follow the program 100%, it's not 90%, not 80%, 100%, they don't need a statin. They just don't need it. As a matter of fact, some of our most profound examples of disease reversal occurred in patients who refused statins or who were unable to take them because of the side effects. And if they are on a statin, I never ask I don't ask them to get rid of it. And if they aren't having one, I don't start them because I know what they can do if they do this correctly. And so far, that's held up. The other thing that I think is important is that I would say many of the patients who come to see us have been told they're not an emergency. They've been told they have to have a stent or a bypass. If they're willing to follow the program, they don't get the intervention.
I will say that based on your, fearless leadership, people do come to see me, some of whom you recommend, and I do appreciate that from your confidence, that we work with, that all other cardiologists have said stent or bypass. I'm a former stent placing cardiologist, so I'm in a pretty good shape, to know who needs and who doesn't. And it takes guts. I say that study called the Courage Study was the best title. It takes a courageous patient to not rush to have what the other cardiologist is recommending. And it takes a courageous, cardiologist to work with a patient because God forbid they drop dead. There's plenty of fingers that are going to be pointed. And anyway, it works out very well, but it is a process that takes guts and, and commitment. So thank you for, setting out that path and being the one that showed us we can do that. So let me, just to be provocative and very respectful, the last patient I saw today, because I do take care of people in other states by telemedicine. I'm fully licensed in about 25 states. Delightful 70, this is literally 35 minutes ago. Delightful 70-year-old woman in South Bend, Indiana. She actually got a master's with Gabriel Cousins, so MD. So she's done raw vegan. She's, studied this stuff. That was 20 years ago. She's been to True North with Dr. Alan Goldhammer, who we also interviewed for this summit. She's done a water fast, and she's been with Chef AJ, who we also interviewed. And she knows, no SOS. She's been to your seminar. I told her we were going to be talking right after her visit. And she was discovered in 2018 when she was running half marathons, incidentally, to have a left bundle branch block on an EKG, no symptoms. Fortunately, totally normal ejection fraction. And in 2022, she ended up having a calcium score and a CT angiogram. She has some coronary artery disease, despite 20 plus years of very strict plant-based eating. She struggles with sugar. She's completely no salt, no oil, whole food plant-based, no symptoms. And she actually has a 25 to 50% left main coronary lesion. Not a good place to have, a lesion, and a 25% LAD lesion 2 years ago. And this was our first interaction. And her cholesterol 2 months ago is 210, and her LDL is 118. She's on no prescription meds. And I told her, I'm going to be speaking to Dr. Esselstyn. And the question comes up, the current guidelines would be your LDL cholesterol should be under 70 and maybe under 55. We're never going to get there without pravastatin or atorvastatin because she's there already. I mean, she hasn't eaten an animal food in 30 years, and she doesn't eat processed food. So in that scenario, in your experience, asymptomatic, do we add in a low dose statin or continue what she's doing?
I'd love to see a 2-week maybe 3 week diet diary of everything that she eats.
Yeah, fair enough.
I would want to say,
She's a breakfast skipper.
you've mentioned that there was sugar, and I can't tell you that, having been in this off and on now for 38 years, what some people, when some people say they're 100%, it's interesting how often, if you really decide, would you mind doing this or doing that? And let's look at exactly what you're eating over 2 weeks. Well, that really didn't count. That because that was on Sunday, and I always have a little extra on Sunday. You know how that is. And so all these little. So anyway, I'd like to make sure that that's absolutely clean.
Right.
First. And I don't like the. I feel like what's it like? What's it like without sugar? Sugar has never been advertised as a great health product for heart disease. And
right.
if she's doing it every day, I mean, is that a little bit of injury every day? And if the other rest is pretty good, maybe that little bit of injury is enough over 30 years to give this mild coronary disease. And especially, I don't like the one in the left main very much.
No, of course. And we're probably going to repeat. It's been about 2.5 years and repeat her CT angiogram.
And she's had sugar all that last 2.5 years, right?
She the last 4 months, she's fallen off the wagon. You know, she'll bake a muffin and it's homemade, whole grain.
I understand.
Yeah. So it's still better than average by far.
So if it turns out that, that everything else being equal, there's nothing in the diet review, you may have your hand forced to give her a statin.
Yeah.
Because right now you've got somebody with a significant lesion. Especially, I'm getting nervous about the left main. If nothing is done, then what is there to say that won't progress?
Right.
Yeah.
Yeah. I just reviewed a couple fascinating articles. I put out a short weekly podcast, and I trained in Dallas, Texas, and William Roberts, who you probably know, editor of the American Journal of Cardiology.
I think he died.
Yeah. Blessed memory. We lost him in the last year or so.
He
wrote a few famous articles. We kill the cows and the cows kill us. And, we think we are one, but we are not one, talking about being omnivores. He was a very pro plant-based, world famous cardiac pathologist. But, one of the tenets of his beliefs were with a cholesterol under 150 and an LDL under 70, you don't have the substrate to build up atherosclerosis. And that's consistent with the native populations you write about that just rarely ever have atherosclerosis. So this woman's, not quite there, despite, far better diet, if not perfect diet than most. So I agree. We're getting repeat labs, a pretty broad panel, and we may introduce a small dose of a statin with a little CoQ10 and do it very safely and just nudge your numbers a little better. Yeah, because again, in your famous publications with your famous pictures and in your book, a number of the people were on pravastatin. I mean, it's not a secret. It's in your publication.
Yep.
Yeah.
And we had some rather striking ones. I want to tell you about this. This is just a few weeks ago. I've never seen the patient. He was from Seattle, and it was in it was in September of 2023 that this 68-year-old began to notice he was getting abdominal pain after eating. So September went through October, November, that pain continued. Then he made some sort of a diet change. He thought something had to do with that. That was in early December. Pain continued. 29th of December, he had imaging done of his vessels to his intestine, and there was a 75% blockage at the superior mesenteric. That was the 27th of December. And it was the very next week, the next day, 5 days later, he called me. And we went over the whole 9 yards, played a kind of hardball with him. Nice guy. But believe it or not, suddenly It was 2 weeks later, his pain was gone. Gone. 2 weeks. That's pretty hard to believe. So the doctors out there didn't believe this either. So they got another imaging. Gone.
Wow.
Gone. I've never seen any. Now, therefore, if you're going to postulate that this lifestyle change has made the difference, which I think we can, that lesion had to be something that was not made of a fibrosis, scar, and calcification.
For sure.
That lesion was made up of inflammation, fat, and cholesterol. It was really profoundly affected by this modification. So but of the years that I've been on this is the first time that I've had a intestinal angina, as it were.
Yeah.
But really quite exciting.
So maybe we'll finish up. I mean, I always like asking, we see legendary pictures of you and your family being physically active. And I mean, it's wonderful stuff, and you on your bike. But tell me, what's yesterday? What's a breakfast of choice for Dr. Caldwell Esselstyn?
I'm a little fussy about, I like old-fashioned Quaker oats with one of the plant-based milks that actually are produced by my son, plant strong milks, plus raisins, plus bananas, plus raspberries, plus blueberries, plus strawberries, plus blackberries, all four if I can, because berries are tremendously nutrient rich, and that's pretty much it. And it keeps me going until lunchtime.
You're not a coffee drinker?
Oh no, I'm not. I've got a couple of papers that one was Greek and the other was Italian, showing how coffee injures the endothelium. And it was interesting. They took two groups of healthy young subjects, one half coffee with caffeine, the other half decaf, and then they would run the brachial artery test for endothelial function after they drank, and then they switched groups. The group that was formerly having decaf was now having coffee with caffeine. It was always the group having coffee with caffeine that injured the endothelial cells.
I imagine when you were a hard-cutting surgeon at the Cleveland Clinic, you had a cup of coffee or two.
I never got into drinking coffee because when my older sister, knew that I never drank coffee when I was going through Yale or through college. But she said, when you get to medical school, you're going to have to learn how to drink coffee. So I said, Sal, if I have to drink coffee because I'm in medical school, I think I'd quit medical school. So no, I've never been a coffee drinker.
Interesting. And then lunch and dinner, I imagine, with all the beautiful colors that Jane can create. It varies.
So it may be soup, it may be an open sandwich, all of which, very modest. I mean, I don't want to gain a lot of weight.
Right.
And supper, my favorite would have to be beans and rice.
Yeah, it's a good one.
Another one that can be delicious. Anne has a portobello mushroom that she uses as sort of a hamburger. And that can be delicious with the various vegetables that go with it. Yeah.
Excellent. We'll run some kind of competition in this summit, and maybe we can get a group dinner with the Esselstyns as the prize. If nothing else, everybody buy all of Jane and Anne's cookbooks, because you can get all the Esselstyn recipes plus just the original 150, out of the park recipes here. So, well, I thank you for your time, for your leadership, for your education. And, really, none of us would be talking heart disease reversal if it weren't for you and, a couple other pioneers like Mr. Pritikin and Dr. Ornish. But you're such a legend, and I hope you have a great evening in beautiful Cleveland, full of colors.
Thank you, Joel, and keep up that. I think it's weekly that you put out that wonderful email that we seem to get with your review of the recent articles. I find that very fascinating, and really I applaud your persistence in putting that out.
I am actually honored to know that you get it. And yeah, it's one of the academic things that keeps me sharp. So thank you for that comment. Say hello to your wife.
Absolutely. All the best. Take care, my friend. Bye-bye.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.